records have become fairly ubiquitous in the U.S. today. By most reports, over 80% of patients are now, their data is now contained in an electronic health record somewhere or another. We have not seen, in terms of measurable metrics, things that really matter from an outcome perspective, that there's been the impact, the positive impact that we were hoping for in clinical quality, in terms of true delivery of better outcomes for patients. If you really want to have interoperability, you've got to have a system that allows sharing across all of those sometimes competing components of the ecosystem. At MITRE, we can be unbiased, trusted, and an intermediary in the conversation and in the whole concept of communicating and sharing data across these organizations. So there have been a number of research efforts going on here at MITRE and elsewhere on this topic. Research on quality, research on standards, research on new methods of interoperability, research on new types of interfaces, and research on how do you use the data for clinical decision support. So one aspect of research that we've been doing has been on trying to create a more generalized approach to electronic health records that captures information from multiple sources. Pull all that together in a way that then is digitized and computable and usable for research to try to show what's really going on with that patient at a given point in time. These questions and challenges and problems that I've described around data sharing and interoperability in the future are really hard. So how can we take some initial concrete steps to get there? I mean, clearly participating with standards bodies and making contributions and using their output is important. So adhering to standards, contributing to the new standards, working together, I think is a logical initial step and concrete step for all of us. If we succeed in helping to create better health data interoperability and data sharing as a result of our efforts, that will lead to a future state where all people, all patients receive better care with better clinical outcomes and better health, and that surely forms the foundation for a safer world.